Indirect and direct fillings has come into dentistry a lot recently. Because a lot of teeth have had large cavity preps done on them, it's not sufficient to go in there and just use large amalgam fillings or large composite fillings. The problem with these fillings is that they flex and there's flexion still in the tooth, and consequently it can lead to fractures. So what we do now is that to hold the tooth together, we can either use an inlay, which is a indirect restoration made in a lab or with a computer that goes into the tooth and holds the tooth together, and that's an inlay. We can use an inlay-onlay where some of the restoration is actually in the tooth and maybe covering a cusp and holding the tooth together that way. Or sometimes you can do a full crown where you cut right around the outside of the tooth and put a cap over the tooth. The problem with full crown coverage is it's very destructive, because often what's happened is there's a large filling inside the tooth, so all the guts of the tooth are gone. Then you cut around the outside to put the crown on because you've got to have room for the porcelain. The difficulty then is you haven't got a lot of tooth left. And when I was training, they often used to talk about doing root canal treatment all the time before crowns, and they'd put a post down the tooth after they'd done root canal treatment. Problem then is the tooth was really weak and became brittle, and often it fractured as well. So we try and keep the tooth vital so it's still alive. And the problem is we've always got to make a decision about each tooth, about how it should be properly restored. And that's where you need to talk to your dentist about which is the best technique for that particular tooth at that particular time. Indirect restorations are more expensive, but they usually last longer. And also they get you biting back into the center of the tooth in the fossa, in the middle of the tooth where the load is supposed to be. So when the opposing cusp bites on the tooth, it's actually biting in the middle again, not on the outside cusps, which have got inclined planes and they're flexing.